For today, best way to reach Doc would be questions@wellpethelp.com. He's super responsive on there. A little bit of housekeeping information for tonight. We do have some questions from email that we will use first.
I would make
During this time, feel free to put your questions into the chat. We are not finishing anything until all the questions have been answered. So, please feel free if you have multiple questions, feel free to ask them. And raise your hand if you are understanding, what's being said. And, we can get some clarification there.
okay, great. So I just wanted to let you know that as regards your questions, that I can't really give you medical advice because I don't really know your patient. I don't have a doctor-patient relationship with them, but I'll do my very best to give you information that I think can help guide you, with regards to what you're asking your question about. But please understand, I'll do the best I can. And we don't just plan on offering them. They're quite popular, so we're going to continue to do them. They can't always show up on the fourth Thursday of each month. Turns out Thanksgiving and Christmas are also on the fourth Thursdays of the next 2 months. So we're going to make modifications that way to so we don't stop doing it. We just don't interfere with your holiday. And like I mentioned, we're recording them live. We're also going to be offering you the PowerPoint handouts, which I think will make it good to take notes on. Um, and then I just want to let you know that after we've gone through the presentation and we've answered your questions, I'm going to leave the end of the presentation to talk about products that we sell on the website. And if you don't want to hear that, that's fine. I don't like being really salesy. I think there's too much salesy stuff going on, and I think the quality of what I do and the quality of these products speak for themselves and don't really need any kind of manipulative marketing. So, and then my book, there's a mushroom for that is our resource text. And if you don't already have it and wanted to get a copy on Amazon, please feel free. And if you do get a copy on Amazon, send us a receipt and we can give you, we'll give you a discount coupon that's good for 25% twice for anything on our website. So that's a good incentive to get that book. And again, as I mentioned just a little bit earlier, please give us some feedback. Let us know what we're doing right. Let us know what we're doing wrong, but also let us know what you think we could do better if we can, and we'll try. We will try. So and let us know in the chat, where you're from, and certainly if you have questions, do it that way. And any comments you have are good there. And if you wanted to not have them be directed towards everyone, there's a function in the chat that allows you to direct it like directly to us that you don't want other people to see what you're saying, and that's fine. I respect your privacy. So this month's topic is detoxification strategies, which is really it's very popular these days. You hear, when you go online and see all these ads and everything else, there's a lot of detoxification talk out there by influencers and by companies that are trying to convince you that their product alone is going to help you or your pet detoxify. Let's talk about toxins a little bit. And these come from a presentation I gave to veterinarians on on detoxification. And some statistics, the earth is a chemical dump. Since World War II, 85,000 chemicals have been registered with the EPA. Many of them are made greater than 1 million pounds annually, and yet very few of them have been assessed for toxicity in humans, much less in our pets. And less than 9% tested for toxic effects on children, and even less on animals, unless they were laboratory animals. And less than 9% were tested to see if there were toxic effects. I think that sentence is a little unclear. And each year, 2,000 new chemicals are introduced into our food, cosmetics, shampoos, personal care products, drugs, household cleaners, lawn products. Even your couch or your curtains or your carpet, they use fire retardants in them, which is great. We don't want things to catch on fire. And there's new fire retardants being created as part of these 2,000 new chemicals. But in every case, we have found that these fire retardants can have a very strong adverse effect on our pets and on ourselves. our pets, you know, they have greater exposure. They're built closer to the ground, sniffing, sampling with mouths and tongues, licking, grooming, tasting, and direct physical contact, rugs, furniture, grass, soil, and they all could have toxic residues on them, which means that they are ingesting every day a little bit more, and many of these toxins get deposited in our fatty tissue and don't really get cleared out of the body, and can continue to have ongoing toxicity. Our livestock are often dipped in pesticides to keep the pests off of them, and they can absorb these pesticides into their meat. We don't test for that in our meat. And farm animals exposed to herbicide spraying, and there's fewer safety constraints. And oftentimes, when we see spraying of glyphosate or Roundup, which is being sprayed a lot on GMO crops, that's probably one of the bigger problems with GMOs is the use of this herbicide, which is used extensively around the world and around our country. Farm animals, aren't kept away from the spray, so they also are exposed to it as well as getting it from the feed that they eat. And they found that that glyphosate in particular does cause cancer. If you look at rates of lymphoma in humans, our heartland, our farmland, where they do all the spraying, has the highest rates of lymphoma, and it has been directly attributed to this to glyphosate. In fact, Monsanto and Dow Chemical that own glyphosate are being hit by a lot of big class action suits regarding the cancer-causing aspects of that. So pets and farm animals are fed these GM crops with higher residues of herbicides, and that's also a problem. Even when they do analyses of pet food for glyphosates, and pet food is pretty far removed from the animal itself, and it has grains in it, which could also be sprayed, and we have the animal meat, which is consuming those grains and those plants. And so we are able to detect levels of glyphosate in almost every commercial food out there. So this is one reason why looking for things that say that they're organically grown. We don't really have GMO legally, according to the USDA, they can't really say GMO free, although there's some companies that provide that kind of certification. But that's a reason why to look for organically certified food. It is more expensive, but the organic certification guarantees that there's no GMOs being used in that animal or plants that have been sprayed with GMOs. So that it's not cheap. Feeding pets these days is not cheap at all, and even if you're going to make your own homemade food, which is a great way to go if you do it right, food itself. I mean, look at all the issues we're having with the cost of groceries, in spite of promises that were made. So, so our pets definitely have greater exposure than we do. And many people call them sentinels. They're kind of like the canaries that they used to carry with them down at the coal mines. And the canaries were much more sensitive to methane gas and the toxic gases that are released in coal mines. And so when the canary would die in the cage, they would say, uh-oh, we better get out of here because, the levels of carbon monoxide and everything are getting higher. These days, of course, they have, tools to measure it with, but it's said that, our animals really are the canaries, the sentinels of human health because they live so close to us and they are exposed to the same things, only maybe even more so. Um, there's just to give you three examples, don't take my word for it. Um, the exposure to chemicals leading to diseases include feline hyperthyroidism. They've discovered that feline hyperthyroidism is caused by exposure to the BPA lining of the cans of cat food. And BPA was originally created as an estrogen substitute. And so BPA is known to be what we call an endocrine disruptor, which means it really messes up your hormones. And thyroid hormone is no excuse, no substitute. And we see this in humans as well. These chemicals have that kind of a problem. It's where we see hermaphroditism and problems with fertility and sperm count and things like that because of these chemical because of this chemical exposure. Transitional cell carcinoma, that's a bladder risk, and there's studies that show that it increases the more that dogs are exposed to herbicides, specifically to Roundup. And even if you live in a neighborhood and you don't spray your lawn, but your neighbors do, there's going to be drift from the wind onto your lawn, and they've proven this objectively with measurements. And if you can control where your dog goes, that's great. But if your dog's free ranging, no telling where they've been and what lawns they've been over. And then, as I mentioned, canine malignant lymphoma, which is we find a high incidence in the Midland and the Heartland, where we have all the spraying of glyphosate and other toxic herbicides, like Agent Orange, for instance, which is originally an herbicide, is increases in dogs exposed to herbicides, and there's research that supports that as well. So these are good reasons why we need to be aware of our toxic world. We need to be aware of how toxins work. And really, toxins wind up building up in the body. And we have toxins that are produced outside of ourselves, which could be like the herbicides, the organophosphates, pollutants, even drugs we take, like NSAIDs, like ibuprofen, can be a toxin to the kidneys or to the liver, especially if it is a sensitive individual, and other pharmaceuticals. And then we have the endogenous toxins. These are things that come from our own body. These are our hormones and cancer toxins and free radicals and different types of immune complexes and things from bacterial infections as well. And the real problem is not whether we have toxins from the outside or toxins from the inside, but as you can see from this formula, it's really the sum total of all the toxins, or they call it the total body burden of toxins or the total toxin load. And so that's kind of how we try to assess the toxicity of an animal, is to see if we can at least objectively list the exposure to a variety of different exogenous toxins and things that we might know are going on with them medically as well. And that's really what we have to deal with in terms of detoxification. Um, so what are some strategies, for that? Well, the best approach is avoidance, if that's possible, or at least reducing exposure if you can't avoid it completely. And one of the few places we have control over that is with what we feed our animals. Because, we make a choice as far as what food to purchase or what foods to feed from our own table or, our own kitchen. And, of course, there are financial considerations. Pet food is not cheap these days, and the better quality pet foods commonly are more costly, but not always. Some of the more costly pet foods I don't think are that great either. And I think this whole new approach that we're seeing to pet care, where we're having these frozen raw diets, we're having foods delivered to the door that are kitchen cooked, but are formulated by veterinary nutritionists, I think are all better strategies. But again, more expensive. And you balance, the cost of food and the health benefits it provides with the cost of medical care. This is one reason why I think a lot of people these days really need to look at getting their dogs and cats insured with pet health insurance. And better and best to have that done as soon as you get them, because that's when the costs are lowest, because they have the fewest pre-existing conditions. Um, and so that's something to think about. For instance, Spencer, my Maine Coon cat, he's got a hole in his heart. Well, before we got the insurance, took him to the vet. I not in practice at that time. We went to a feline specialist who recorded it in the records. We're forever not able to get decent health insurance that would cover him in later life from that hole in his heart. So you want to look at what's in the commercial foods, okay? And you want to realize that the ultra processing that goes on with the heat and pressures from kibble and can also creates toxic byproducts, not just what's in the food, but how the food's processed can create toxins. And I want to say overfeeding is toxic. The obesity is a health concern. And although our animals look at us with those beautiful little brown eyes, and and our heart goes out to them, and we know that when they feed them, they're really happy. They've got us real trained. It's not in their best health interests. We know in studies where they have fed dogs 25% less than what they need to maintain their same weight, they actually live several years longer. So watch how much you feed. Overfeeding can be toxic as well. And there's something called intermittent fasting. These are detox strategies I'm sharing with you. And intermittent fasting means maybe not feeding twice a day, maybe having 12 hours between meals, which might mean that you or well, maybe 24 hours between meals, sorry, where you might feed in the morning and not feed until the next morning. And that's what I've done with all of my animals, in part because I'm lazy, but it was great to see the study that said, wow, that actually reduces the risk in cancer, but it's easy to do. And your animals aren't going to like it, especially if they're used to getting fed twice daily. But maybe you can give them something healthy as a snack, in the evening when you might normally be feeding them. Maybe something that has some antioxidants in it, or mushrooms, or things that are going to be beneficial to their health that look like their food, but they're not really. Maybe some soft chews or treats or something that are functional treats. And then, look at environmental exposures. As I mentioned, the lawns, carpeting, furniture, fire retardants, flea and tick medications can also be toxic. So everybody's life is different. All of the things that they're exposed to in their life are different. I can't give you one blanket strategy to use. And this is really, I don't want to spend too much time on this first part, but I want to give you kind of the principles of this. So, take an assessment, of what's going on in your environment, of what's going on inside your house and outside your house, and what diet you're feeding, and try to feed the best food that your budget, can afford, because not everyone can go the Cadillac route. Some of us have to go the Volkswagen route, but still, they still get us where we're going, and sometimes using supplements on top of foods that have detoxification functions can be very helpful as well. And so that's kind of what we're going to get into next is I think that avoidance is the best. I don't think supplements are a solution. I think diet is more of a solution. I think supplements are helpful, but not as a standalone. And so that's what we're going to talk about next is influences on detoxification. For instance, the liver is the major organ in the body that detoxifies, that breaks down these toxins into water-soluble substances that the kidneys can then excrete. The lungs do it to a little bit, and the kidneys to a little bit, but mainly the main organ is the liver. And so the liver takes a hit. All the food, all the toxins go to the liver first before they go to the rest of the body. And so the liver tries to detoxify these things, but in some cases it gets overwhelmed and becomes toxic itself and then is less able to detoxify. So the liver, good diet feeds a healthy liver. So again, diet, diet, diet. Look at the quality of the diet. Is it organic? Is it non-GMO? Remember, about we're concerned regarding Roundup residues. Too many complex carbohydrates can be pro-inflammatory and inflammation. Inflammation makes toxicity worse and feeds into other kinds of disease processes. The quality of the protein support. We don't just want to give high protein. We want, and in most cases, high protein is good, but we want to make sure that the protein is digestible and it's protein they need because you need to have, the essential amino acids, which is what we use to call it, protein quality. We want to look at the fatty acids we're giving, the fish oil, the EPA, DHA, the flaxseed meal. Those all are very helpful. They help to reduce toxins. They feed the liver, but you also get more free radicals because they've got all those double bonds in them that under oxygen and light and heat can get fractured that create these free radicals. So, if you're giving a lot of fatty acids, which are good, make sure you're also giving antioxidants to help reduce that potential. And you want to feed food that's microbiome friendly. And high carbohydrate diets are not microbiome friendly. Microbiome likes healthy fats, likes protein, and likes fiber. We want to make sure we're giving a lot of healthy fiber. One of the nice things about mushrooms is they've got really healthy fiber in them, which helps to feed the microbiome at the same time as their immune modulating properties help to support a healthier microbiome. So I think so mushrooms, and I guess I'm the mushroom guy, mushrooms, can be a really good tool to use and can help with liver detoxification as well. And there's ingredients in real food. Like broccoli and watercress have things called glucosinolates that have been shown to be cancer preventatives. Grapefruit juice contains something called naringenin, which is a bioflavonoid. Um, and and it can be very helpful as well in terms of liver detoxification. Pomegranate juice contains something called ellagic acid, which is also very good for detoxification with the liver. And then milk thistle, which we don't normally eat as part of our food, but is a great supplement in terms of the silymarin that the milk thistle seed contains, which helps to stimulate liver detoxification enzymes and improves the overall function of the liver and protects it from damage. So, you know, we're looking at plant-based antioxidants as detoxicants. We talked about silymarin. I think a lot of people have heard about turmeric. Turmeric is great stuff, and you could add it as a spice to the food. To get good biological benefits, you'll need to add quite a bit of turmeric, but they also make turmeric in a kind of pill form that's much more biologically available. So especially if your animal is one that doesn't like the taste of turmeric, or you just have a lot of other things to do, and it's easier to give a pill. We have products that have both the silymarin and curcumin in them, and then flavonoids. Mom was right. We should be sure to eat our vegetables and our fruits, especially the ones that are brightly colored, because it's those bright colors that contain the anthocyanidins, which is one type of antioxidant. And pomegranates, strawberries, watercress have this ellagic acid, which helps to stimulate liver detoxification. Quercetin is a great flavonoid that also has antioxidant and detoxicant properties, anti-inflammatory properties found in fruit, vegetables, onions, and then green tea. Can't beat green tea for its antioxidant properties. It's probably the cheapest antioxidant available to you. Even a baggie of green tea that you steep in a cup of water and pour on the food is going to have some good antioxidant benefits. It's probably the most common antioxidant in the whole world and the least expensive too. Something that's very easy for you to do. So that being said, the next part is where we're going to talk about supplements that we sell that are good detoxicants. But as I said, we're going to wait until the end because I don't want to be too salesy. And Haley's going to show pictures of them so you can know what to associate them with. But I've specifically designed formulas to be good for reducing toxication. So we'll talk about the daily dog and the functional feline again, hepato support, which has the silymarin, curcumin, which has the RX curcumin, and then a few other things: fish oil, reishi mushroom, five defenders, and RX biotin. So that ends the information portion for today. I'm going to stop my share and come back and see everybody. We've got 29 people. That's great. Welcome. Welcome to you all. So, what do we have as far as questions? Let's get going on that.
Yeah. And feel free if anyone has any other questions, you can put them in the chat as well. But I will start out with the ones from email here. So, first question. As winter approaches, I'm hoping my dog's allergy symptoms will diminish for a few months. She's been on milk thistle for approximately 5 months. What does she need now during this allergy season? Or, I'm so sorry. What does she need now um, to be better prepared for next year's allergies?
Okay. Well, you're describing what we call inhalant allergies or seasonal allergies, and they can be pretty nasty and they can be difficult because we can't, it's not like a food allergy where we can maybe change the food. So we can't really eliminate those allergens until, the weather changes, kills all the plants that are creating those allergens, if in fact. But in the wintertime, we do see some inhalant allergies as well from house dust, those sorts of things that are inside the house. So, um, and depending on how severe it is, there are conventional approaches to allergies that I think are not bad to use, such as allergy testing and either giving allergy shots or now they're doing it orally, kind of like a homeopathic. The allergy shots are nice. It's like weekly or monthly. The orals are like daily. But those are approaches that take some time to work, but can certainly help. Um, Looking at using supplements that have anti-inflammatory activity, like fish oil, for instance, is probably one of the best things I'd recommend for allergies, but you need to give a substantial enough dosage of it and it needs to be given for about at least 3 months to see effects. There have been studies that have measured its anti-inflammatory effect, and it does take about 120 days. for that, of 90 to 120 days. So that's one thing, looking at fish oils. Turning the page to my favorite mushrooms, we do know that the reishi mushroom and the chaga, which is not a mushroom but is considered by some to be a mushroom, have these terpenes in them that stabilize mast cell membranes, which helps to reduce histamine release. So I think those are good to use throughout the year. Plus, because they have beta glucans in them, the beta glucans help to improve the microbiome because we've seen that in some cases with allergies, if we can improve the microbiome health, the allergies go away. So that's something that I'm actually learning about right now. I'm taking a course on microbiome replacement therapies. And once I get a little smarter, we'll talk about that some more and some of the things that you can use that are available commercially online to help your animal's microbiome. And many of the foods I'm recommending already are microbiome friendly, and mushrooms are microbiome friendly as well. So, so those kinds of things I think would be good to use during the down season, which is what you're talking about now, when the allergies are kind of at a low level. Other things like quercetin, for instance, which I mentioned before as being a detoxicant, it's a flavonoid. Quercetin is known for its ability to help reduce allergic symptoms. So there's things such as that which could also be added to your dog's program. And if there are some, and the food itself, kibble is very commonly fed, and it's very very commonly fed. And unfortunately, kibble is, for to a large extent, carbohydrates and processed carbohydrates. And so the processing of these carbohydrates creates secondary um, substances that have a pro-inflammatory effect, and the carbohydrates themselves have a pro-inflammatory effect on the microbiome. So looking at the diet can also be helpful. I know I've heard some people that had inhalant allergies but not food allergies switch to more of a fresh food type of a diet, one that's minimally processed, maybe one they make themselves, maybe it's lightly cooked in the kitchen, or maybe it's raw, and have found benefits with that, in perhaps because they're lowering the inflammation level in general in the animal, so the allergies don't have as strong an effect. So there's my answer.
All right, next question. We are in the process of adopting a deaf kitty who will only eat kibble. She has some goopy eyes at times and sneezes out snot at times, and I want to boost her immune system. We were told, and finding it to be true, that she won't touch raw, wet, or fresh meat. She also refuses the treats we've offered. I wonder if she has a chronic upper respiratory condition that messes with her smell. I'll keep trying, but in the meantime, I want to get functional feline in her. The only thing I can think of is to get wet food I can blend and syringe with the extras in it, but that isn't a long-term solution. Any other suggestions or tricks to help boost her immune system? I know it's best to support their immune system and let it do the work.
Well, good question. And there are kitties like the one you've adopted. And, I think they get started out eating kibble and they don't really get much variety in different types of food. And so they kind of get fixated on the kibble and are reluctant to change what they're eating. So, and it may be that there's nothing that can be done for this cat. Some cats are adaptable over time. But I also think that your assessment as far as maybe a chronic upper respiratory, chronic rhinitis type of a thing, nasal type of infection, viral is possibly correct, especially if this kitten came from or cat came from a shelter where there's, a lot of airborne diseases, going around. And probably the most common type of upper respiratory in cats is the feline herpes virus, which can manifest itself as the kind of goopy eyes and nasal discharge. And yeah, it might be she just feels miserable, and so I think the functional feline is a good choice. It's very, very palatable. We had a panel of 6 vets on a recent live I did, and they all said that they were just so impressed with how palatable it has been for their patients. That doesn't mean it's going to be palatable to this girl, And so my trick to getting something like this started is to start with a very small amount. Oftentimes, cats will be open to trying something that's not overwhelmingly strong smelling or overwhelmingly a different texture or something like that. So, and it might even be that, if she prefers dry food, dry food oftentimes has a little bit of an oily coat to it. You might even look at maybe taking a little bit of the functional feline, just a pinch or a whisper, as they say, and mixing it in a baggie with the kibble and start feeding the kibble with it, because I bet you would see that much of it adheres to the kibble. Um, but I think, keep at it. I think you're on the right track. The functional feline has some really good mushrooms in it to improve immune system function. It's got good probiotics in it. It's got krill meal, which has a lot of those good fish oils and lecithin in it. Um, One more thing is there's an amino acid called lysine, and it's readily available, on Google, lots of places, and there may be some liquids with it in it, but she may be not that easy to give a liquid to either. You may have to squirt it in her mouth, and she may not like that. Although if you find a liquid, that would be good. Um, there is one that I designed that RX Vitamins makes called, I think it's called Immune Support. It's a drop, but it has lysine in it. And the amino acid lysine actually interrupts the reproduction of the herpes virus. And so it's a very nice, kind of a benign way to try to treat that upper respiratory at the same time as you're improving immune system function. And I would use the same approach to the lysine as I would with the functional feline, which is start with just a little bit and be patient and try to work your way up there. But I think those are a couple of and 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 thank you so much for taking in a cat like that and doing your best to provide it with quality of life. That's good stuff.
All right, next question. I have been using Daily Dog for a while now. Individual real mushrooms, pet mushrooms before that, and just heard mushrooms should be given every 12 hours for best efficacy. Would it be better to divide the dose and space by 12 hours for dogs and humans? I take mushrooms too.
You know, it really doesn't matter how whether you split it up and give it 2 times a day or 3 times a day or take it once. If you've got a critical problem, where you're going to have to get a lot of mushrooms into yourself or the animal to help with that, then dividing it up several times a day might make it easier to get that powder in there or a couple more capsules or soft chews or whatever format you're using. Um, but in general, most of the things in mushrooms aren't drugs. They are not drugs. Mushrooms are superfoods. And just like any food that we eat, um, it doesn't give it, well, I mean, sometimes you get like a nice immediate, oh, I feel really good from eating this food. But generally, the best effects from food, take more time. And so, I wouldn't worry about that too much.
Right. What would be the safest, and most effective supplements for a dog with kidney disease?
Well, kidney disease has a lot of different flavors, and there's a number of different issues as the kidney disease gets worse in terms of blood pressure and protein loss and things like that. And certainly, we look at some diets. A fresh food diet that's got a lot of water in it is good. Protein restriction depends on how severe the kidney disease is. If talking about a dog. Um, I've designed several supplements that seem to work pretty well for kidney disease. I'm not sure we're selling the RX Renal anymore on our website, but I think we might be. Sometimes I keep products on the website and because I think they're really good and I'd like people to buy them. But then when they don't get consumed enough and we wind up having stuff going outdated, we say maybe we shouldn't carry that anymore, and it's available online, if not on our website. Haley, can you check to see if we have RX Renal there? I think I can't. I think we still have it. We get good reports from that. And part of the secret sauce for RX Renal is it contains cordyceps mushroom. And cordyceps mushroom, and if you have a dog with renal disease, I would probably use both. I would enhance the amount of cordyceps you're giving. Fish oil has also been shown to be really good for chronic kidney disease. And there may be some other things as well, if we look more closely at exactly what the cause is, the type of the severity, of the kidney disease. But I think those are a couple of very simple solutions that are actionable easy to access, and may be very helpful in terms of improving your dog's status with its kidneys.
All right, next question. Sadly, Bruce Wayne, my 11-year-old Chihuahua, had swollen lymph nodes with a high white blood cell count of 29K and other alarming blood markers. We're awaiting his flow cytology results now. My vet is hoping it's T-zonal lymphoma and mentioned prednisone as an option for treatment if that's the diagnosis. I've heard nothing but bad things about prednisone. If that's the case, what would you suggest I give him to help offset the bad effects of a steroid drug?
Well, and I know Bruce Wayne. I see him all the time. I'm sad to hear that. And it does sound likely. I don't want to do things in advance, but it sounds like it may be similar to what your vet's saying it is. And we'll learn more from the flow cytometry. I think he meant B cell. B cell is easier to treat than T cell. Um, and prednisone is a steroid, and it has good uses. It's good to be able to have that available if we need it, but it tends to get overused. And the problem with prednisone for lymphoma is that it does kill the lymphocytes, the cancerous lymphocytes, but it doesn't kill them all. And so it kills the ones that are sensitive to prednisone, but it doesn't kill the ones that aren't sensitive to prednisone. So that means you'll have some good results. The lymph nodes will go down. He'll be feeling good, although the prednisone will cause him to eat more and drink more and maybe put a little weight on. But then, it's different for each animal and the type of cancer they have. But generally, 3 or 4 months later or 6 months later, the lymph nodes start growing again. And then to use prednisone a second time or a higher dosage is probably not going to work. So you might want to look at talking to an oncologist about this and find out what perspectives they can offer you. We used to use, just a very high-end chemotherapy that used high dosages for the dog, not as high as in people. Dogs do better than humans do, by the way, with chemo. Um, but now there's some new drugs that are given that aren't like chemo. They're not, these huge infusions, and I think there's several of them out there. Some are even by tablet. And what they promise is not so much that they cure, but they keep it down. They manage it. It turns it into a chronic disease, which might be the best thing that you could ask for. So I don't know where you are in terms of the country or who you might be referred to. And if you wanted to reach out to me personally, I'm happy to share that with you, or I'm happy to see if I can help you.
Yes, we do love Bruce Wayne very much.
Mhm.
All right, next question here. I have a formerly stray Tom Peepers who was neutered approximately 8 years ago and has been an indoor cat since then. I feed him according to Dr. Basco's recipes, and this cat will eat anything I put down. He had one rabies vaccination at neuter, no vaccination since it isn't required in Ohio. Question today is why do you think Peepers humps his sleeping pillow every day, sometimes multiple times a day? Once he is done, he props himself on the floor to clean himself. His pillow is like a fuzzy donut with leopard type fur design. He sleeps in the middle. He is 13 pounds and never complains, eats great, stool and urine output is great, and overall a great cat. Just has this puzzling quirk. I was a vet tech for 20 years and have not come across this before.
Okay, well, that's a good one. I like that. Um, and quite a contrast from the cat that won't eat barely anything. Um, so it's possible. He said he was a tomcat for many years before he was neutered. So in a way, the testosterone that he had while he was a tomcat kind of programmed his brain, even without the testosterone present from the loss of his testicles. Um, and that may be what he's doing. And, let him have his fun. I don't think it's harmful. On the other hand, it's also possible that when they went to castrate him, neuter him is a more friendly term, isn't it? When they went to neuter him, they may have left a little bit of testicular tissue in there. It happens, especially in busy, rescue operations or things like that, or sometimes it's not being done by veterinarians or even by technicians. So if there's a little bit of testosterone in there, a little bit of functional testicle, and he has this kind of behavior pattern anyway of humping whatever is in heat, um, that would explain it. I don't think it's a problem. I think it's hilarious, actually. And I don't mean to be insensitive, but that's a nice question. Thank you. Keep them coming.
All right, next question. What ratio of DHA to EPA do you recommend?
I don't think it really matters that much. DHA has some very special qualities different from EPA. I recommend DHA dosing according to DHA based on if they have cancer, because DHA has a better effect on cancer than EPA does. DHA in young puppies and kittens is very good to help with learning and with neural development. Mother's milk is very rich in DHA for that very reason. When we try to dose fish oil, which a number of different products out there have varying levels of EPA and DHA, what has been suggested by an expert published in the American Journal of Veterinary Medicine, American Journal of Veterinary Medical Association, is to add the DHA to the EPA as a single value and then give that sum at the dosage of 100 milligrams per kilogram of body weight per day. You could divide that into a couple of dosages. And that's supposed to be the anti-inflammatory dosage for fish oil in general. So, I think it's a good question. Obviously, you're knowledgeable, and interested in doing the right thing. And I wouldn't sweat it too much. I would just make sure that you're getting a good quality fish oil that's, cold pressed and is of good quality. We have a good quality fish oil on our website that comes from, and you want to look for fish oils that come from the smaller fishes there's contamination in the oceans as well. We didn't get into that, but as the smaller fishes eat the contamination and as the fish gets higher on the pyramid of life, they consume more and more of these toxins. So cod and salmon are at the very top of that pyramid of fishes. And so cod liver oil and salmon oil, because of the fact that they eat all these smaller critters like plankton and krill and whatnot, um, tend to concentrate and have more of mercury and the contaminants that we see in the ocean. So you want to look at where the fish oil comes from and where the lipids come from, really. And probably the best is algal oil because algae can produce DHA and EPA. And most algal oil actually produces higher DHA to EPA. And I've been looking at a couple of different brands of algal oil, thinking to add that to our inventory or sell them on an affiliate because I think there's a real place for algal oil. When I was looking at the label myself, I was going, I think I want to take that stuff. So anyway, so good question. Thanks.
All right, next question. Should a dog with the start of kidney disease have more omega-3 than recommended on the label?
Oh yeah. What label are we talking about?
Mm,
The food label or the supplement label for fish oil? Definitely. And I think what I just quoted as far as a dosage for fish oil and a way to determine it is good for any brand, for any bottle that you have, and which is to uh, add the EPA to the DHA and then give 100 milligrams of that per kilogram of body weight per day. And a kilogram is 2.2 pounds. So basically, it's half that. So you want to do 50 milligrams of EPA plus DHA per pound of body weight per day. And that's what I would look for.
What
And
are
good.
your
Yeah, it's good to have fish oil questions. I think of every supplement out there, the one supplement that everyone should take is some form of fish oil. I think the fatty acids have such a global benefit to so many systems in the body, brain, kidneys, skin, immune system, heart. It's like, it's a no-brainer to remember to take your fish oil or your algal oil.
All right, next question here. What are your suggestions regarding potential Lyme in a dog and detox?
Lyme disease, is that what they're
Hmm.
referred to?
Hmm.
Well, I think you need to get a diagnosis. I think you need to do the blood tests. You need to figure out if Lyme's disease is in fact a risk. Lyme's disease is pretty nasty, especially I mean, not just when you first get it, but if it winds up being persistent that can create a lot of inflammation in the body that can lead to arthritis and other problems. And I think, I think we have to look at what we're using to treat the Lyme's disease and maybe not worry about it so much if it's an antibiotic because the you have to weigh the risk to the benefit of what you're doing. And Lyme's disease itself, in many situations, is pretty nasty and pretty long term and pretty hard to treat once it takes root. So I think you need to know what you got and you need to treat it aggressively, and maybe I'm misunderstanding the question. But in terms of detoxification, detoxification or toxins reduce immune system function, period. So obviously, using detoxification strategies, using immune modulating agents like, let's say, turkey tail mushroom could be really pretty good for Lyme's disease. We don't have studies, but it's known to be good for infectious diseases at higher doses, is where I would get started with that.
All right, next question. My dog is limping on his left front legs, on his left front leg. At times it's better, but then he starts again. He has protein in his urine and elevated liver enzymes for years, but is doing well. Is there a supplement that might help his limping in the front leg?
Well, the limping in the front legs, it sounds like it may be due to an injury, or maybe there's some underlying arthritis that time has just started to make it flare up. So, for the liver, the elevated liver values, looking at some sort of a milk thistle product like our hepatosupport might be helpful for that. It'd be good to know why they're elevated. And there's a lot of different reasons why liver enzymes can be elevated, and some of them are more treatable than others. If you know what you've got, you know better how to treat it effectively. Um, and as far as the mobility, sometimes, if they're not allowed to rest, if there's an injury or, some chronic inflammation in a limb, and then they somehow do something in terms of activity to cause that inflammation to flare up, they then get sore and they tend to hold it up and not use it. But then when they get less sore, they start using it again because dogs don't like to be three-legged. They want to have four legs. So, so resting, and being, sometimes leash walking, instead of letting them just loose. But and leash and resting is important. It can be, 3 weeks or 6 weeks or 8 weeks, and dogs don't like that. Pet parents don't like that either. They're used to being active with their pets. But in order to deal with the limping, that's maybe what you need to do. Again, I'm a veterinarian, so I think, an orthopedic exam, to find out which limb and which joint in the limb and possibly some x-rays to see what the problem is, I think allows you to be more effective in your treatment in spite of the additional cost of visiting the vet. And I know these can be expensive. And that's why at the very beginning I said, boy, we really need to start looking at pet insurance because vet costs are getting so high, and we still need vets to do these kinds of things. We can't do it ourselves, and I can't do it online for you. We need to have somebody hands-on that can help define what the problem is and give us a more specific solution to it.
So, next question here. My 20-pound, 14-year-old cocker has been on your lion's mane for about 2.5 months, one capsule a day with food. He has cognitive decline signs. He seems to be stable thus far. Should I consider increasing the dosage? If yes, do you have a recommendation? Also, I am a mushroom fan, so I would like to know if I want to add another mushroom to his regimen and what would be some good options.
Well, yes, I would try more, and I would just try another one, try one twice daily and then watch it for a couple of weeks more. You obviously know how to detect some cognitive dysfunction. See what another one does. Maybe it'll help. Maybe three would be better. Each animal kind of charts their own needs. And as far as another mushroom, there are a lot of, I mean, all mushrooms contain the ergothioneine, which is part of what's helping the cognitive dysfunction in your dog. And lion's mane contains the ergothioneine. It also contains the triterpene, the hericenones that we know are part of why lion's mane helps with memory and things like that. So almost any mushroom would be good to contain that. In particular, you might want to consider the five defenders, which has both maitake and shiitake in it. Both of them have ergothioneine in it. Cordyceps has ergothioneine in it. Um, and then of course my daily dog and functional feline have seven mushrooms in it, two of which are the lion's mane and the golden oyster. And the golden oyster is a major source of ergothioneine. It has the second highest amount of ergothioneine of all the mushrooms we've measured, second only to porcini mushroom. So, and you can, and then again, if you do a homemade home diet, get some lion's mane mushroom or get some golden oyster mushroom and cook those up and serve that with the food. And that could be helpful too, since you're a mushroom head like myself. Hmm.
All right, so next question, and you had discussed this a little bit before, but I was wondering if short fasting could reset my dog's system. Does fasting or intermittent feeding have any detox benefits for pets?
Well, it does, in fact. And, while the body's not busy detoxifying each meal, couple meals a day, and dealing with diverting its energy to digestion as compared to detoxification and immune vigilance, yeah. And studies mentioned earlier, maybe you came on a little late, but mentioned earlier that they've actually found that one feeding dogs one meal a day actually helps to reduce their cancer risk. So I think it's definitely a good idea. I'm not quite sure what you mean by reset the system, but I do think it's a healthy to do. And as I also mentioned earlier, if your dog's used to getting fed twice daily, it may not like your change in its routine. Animals like and people are both, creatures of habit. We like to have things at certain times of the day. My dog tells me when it's time. He comes downstairs. He says, "It's dinner time, dude. Get off the computer." So, it can really help to reset them, but you may want to give them some kind of a treat or something, not a lot of calories, but something that may be functional, at that second feeding, and maybe something that contains mushrooms that can help with immune system function and other things in the body or cognitive function or whatever the issues are that you're dealing with. I'm sure there's a mushroom for that.
All right, so
No,
this is the
it could
last
matter to a book.
question
Yeah.
that we currently have here.
Okay.
My middle-aged golden has been on long-term medication for arthritis. How can we support detoxification for dogs that rely on prescription meds without interfering with their treatment?
Well, that's where supplements come in. And, for instance, we've been, when Rimadyl first came out, we were very concerned about it because, everyone thought it was totally safe and we just started giving it out like candy. And some dogs that had sensitive livers, didn't do so well on it. So we started using, and that was kind of where I got the idea way back when to create the hepatosupport with the silymarin in it as a means of helping to protect the liver from these potentially toxic drugs. Likewise, when we talk about Bruce Wayne and the possibility that he could be on steroids, milk thistle can help to reduce the toxic effect of steroids on the liver. So I think those are some things to think about. And I think it's a very appropriate question to ask while we're talking about detoxification, because pharmaceuticals are one form of exogenous toxin, as I mentioned on one of the slides back there. And we can't alter I assume you're seeing a benefit with it. Sometimes what I'll do in my own practice and with Ollie is I'll change up the NSAID. I'll stop the Rimadyl or whatever, generic Rimadyl now for him, give him a week to get off of it, get it out of the system, and oftentimes I'll observe him getting worse, or maybe I won't observe him getting worse, and then I'll try a different NSAID, which may have different levels of toxicity, maybe more may affect the kidneys more than the liver. Like for instance, Metacam or Meloxicam is more directed towards the kidneys and a little better to the liver, whereas Rimadyl is more towards the liver and a little better for the kidneys, but not so good for the liver. So sometimes that can actually increase the response to the NSAID by using a different one. And that's a strategy. Looking at adding to the use of your NSAID joint lubricants and joint formulas that may help to reduce your need for that NSAID or as much of that NSAID. NSAIDs are really much better for acute pain. They don't do as good for chronic pain. That's where things like acupuncture, massage, chiropractic, supplements can be much more helpful. Laser therapy, pulsed electromagnetic force. These are all different strategies that we can use to help replace the benefit that we're seeing, if we are seeing a benefit from the NSAIDs at all. Good question, and thank you.
And we do have a couple more questions that came in through the chat here.
Keep
So
them coming.
here's one of them. What do you think about detox binders as a regular supplement, such as, is it chlorella?
What do I think? A detox. What was the word after detox?
Detox binders as a regular
Binders.
supplement.
Right. Well, I have cracked cell chlorella in the daily dog and the functional feline, both. So yes, I do believe, and they're meant to be given on a daily basis. Now, what she's referring to is the fact that chlorella, which is a form of green algae, has a very sturdy cell wall that you have to kind of crack it open. And when you do, it turns out that chlorella can help to chelate or bind up heavy metals and things that are toxins as well that we see in our environment and our foods and our water, things your dog might be licking, but for some reason. So yeah, I think chlorella is fine. And I think in most cases the binders are okay. There's some situations, where we have types of clay that can bind up toxins as well. But and that can be good depending on the type of clay. But some clays actually coat the bowel, which is what we want them to do because they can protect the bowel from injury and damage and inflammation. But they also can interfere with the absorption of nutrients and the absorption of pharmaceuticals. So if you're using that kind of clay, you have to time its use to be away from food and away from drug or supplement administration. But yeah, no, I think binders are one legitimate way to look at helping with the detox, especially for heavy metals. And I didn't really talk today about laboratory tests and things that we can do, and I'm saving that because I'm right now I'm evaluating different laboratory tests that we can offer you on our website that would also help you to assess the health of your animal, the toxicity state, and then from that we would have more specific information if we knew what the toxins were as far as what kinds of detoxicants to suggest. Let's say, and sometimes I think these days they're looking at hair analysis, as a way of assessing these toxins. And there's several companies that offer it. I'm trying to figure out which one's the best bang for the buck. And so that can tell us, let's say that we've got heavy metals, which might be a reason to lead us to use the chlorella, maybe at higher dosages, because the dosage for it in the feline and the dog formulas is relatively low because it's meant to be administered a little bit every day as kind of a wellness thing. That's a good question too. Got a lot of good questions today. I like this community that we're developing here. I think you guys have a lot of interest and a lot of motivation, and I'm really happy to be here helping you. Was that it?
There's two more here.
Okay.
Can PEA be used instead of NSAIDs?
Well, there are some studies that show PEA can have a benefit with pain. And there are some studies that show that PEA in combination with CBD is even better for pain than either one of them alone. So I think the answer is maybe. We don't, it's very individual. Each animal has their own level of pain and their own system that uses the supplements to reverse the pain. And so I think that it can be helpful. I have a lot of pain myself individually, and I take the PEA and the CBD together. Oftentimes, I can't really tell that it's doing anything because you don't know. It's like every day, all the time. So I'll go through periods where I stop it to see is it still working for me? Is it still doing something? And usually, it takes a couple of weeks. Then I start getting more painful, and then I start them back up again. But we've got a good PEA on the website. It's a really good quality. It's micronized, which means it's more absorbable than some of the other PEAs around. It's in a capsule form, which gives you a specific dosage. It's a human product. So, it's Doesn't have any pet labeling on it, but we have a lot of information on the website as far as how to administer it. And dosages for PEA are well established in the veterinary literature. We know exactly what these studies tell us and how much to give. So reach out if you need some help with that kind of stuff, dosing and product selection and stuff like that. We're kind of getting to the point where we're going to talk about products anyway, so I'm feeling like I'm not being too salesy here. Just give some examples. Another one? Are
Yes.
we okay?
My 25-pound Labradoodle is on monthly flea and heartworm medicine. What do you suggest for detoxing?
Well, do you really need that monthly? I know some parts of the country you do, and it gets pretty bad. Flea medication, fleas spend most of their time off the dog. So oftentimes looking at environmental solutions to fleas, which oftentimes involves vacuuming baseboards and looking right outside door entryways and bushes and things. There's things you can use like diatomaceous earth that are non-toxic. And there's some things like powdered giant chrysanthemum flower, which is rich in pyrethrins. And pyrethrins of all the pesticides are out there are the shortest living and least strong, but they're still pesticides. So there's things like that that can be done. They've got some new substances called insect growth retardants, which actually interfere with the life cycle of the flea. So it kind of stops them from reproducing. So I think, as far as fleas are concerned, I would look at that. Now, the modern medicines that they have for fleas and ticks, they're all combined, and they maybe give you a pill or they have it as a spot on drop. And some of them, last extended periods of time. And so I would suggest if you can find it, and generally there's a lot of stuff available online these days, um, I would try to find some of the older products for fleas and ticks, the more legacy products. They still work. They work. It's just, the industry has to always come up with something new, something brighter and shinier and more expensive, so they can chart larger profits every year. And so I would look at some of the legacy products. For ticks, ticks can be a problem. We discussed the issues with Lyme disease, and but oftentimes ticks are seasonal, except for certain parts of the country where they're not, and they abound. Um, and and the tick-borne diseases can be really nasty. So for Ollie, we don't have a lot of ticks or fleas here in Colorado, which is pretty dry, but we do have a pretty robust tick season in the springtime. And Ollie kept getting them on his face because he likes to lie in the bushes. And I was worried about missing one or two and having, if there were a tick-borne disease, having it transmitted to him. It takes about 24 hours once a tick has attached for it to transmit the disease-causing agent. So I gave him a dose of Frontline. The Frontline is one of the first spot-on products we had for ticks and works pretty well, although after like 6 weeks or 8 weeks, he got another tick on him. So I gave him 1 month, and there was like a month in between, and gave him another. And he seems to be doing pretty well as far as liver values and things like that. So it's tough. Okay, and I'm just talking a lot. You asked what do we do to help with these? And so one, I would try to minimize their use by working in your environment and maybe looking at a different product that might not be as modern and as toxic as these modern products can be. Um, and then, I would look at ways to support the liver in its detoxification. And we've talked about that quite a bit. And, there are supplements, like my hepato support, which has the silymarin and alpha lipoic acid and B vitamins and stuff in it. That could be quite good to help support the liver. Looking at all the different sources of toxins other than the flea and tick um, treatments. As I mentioned, it's the total toxin load. It's not just what you're getting from those. So maybe if we can't stop using those or reduce their toxicity as enough, maybe we can look at other sources of toxins and try to eliminate those. Maybe look at diet, because diet's ultimately the most controllable thing, the thing that we have the most control over. And so maybe go there and try to reduce the total toxin load and try some of the suggestions I've made as far as those kinds of products. The looking, some people absolutely abhor those drugs, and I don't blame them. And what they'll do is every day, when the dog comes in, they'll go over them literally with a fine-tooth comb if their hair allows it to find the ticks, and there's certain areas the ticks like on the dogs, like around the ears and the face and the groin region, around the butt area. And normally it ticks like they hang out on these bushes and they kind of jump on the dog as they go through. So that's why you tend to have them higher up on the dog, like the head and the ears and the tail versus down by the feet. So looking for the ticks and removing them is as effective as using a chemical, if you can do it and keep it up. Longer haired dogs, obviously a bigger problem. Smaller dogs with short hair, a lot easier. So there you go.
So we are all good with questions. Shall I share?
Yeah, let's take a look at some of the detox products we were mentioning at the very beginning. And this is Haley's screen. I didn't get time to put the pictures in of the different products, but I mentioned a couple of times the Daily Dog and the Functional Feline. These are my two newest products, and they were meant to be kind of an all-in-one sort of a thing because I know many pet parents get tired of all the bottles and all the pills, and they want to have it all combined. I don't think you can really do everything all in one, but this is a pretty good effort in that direction. It has 7 mushrooms in it. It's got the 5 defenders plus um, cordyceps and lion's mane. It has 3 adaptogens, 2 of which are mushrooms. One's ashwagandha. It has live probiotics that are not heat sensitive, so you don't have to store this in the refrigerator. It has milk thistle seed and chlorella, which are good detoxicants in themselves. The krill meal is a good source of the EPA and the DHA, excuse me, but also a source of choline, which is a phospholipid found in lecithin and helps to increase the absorption of the EPA and DHA. But choline also helps to support the liver and a healthy nervous system. Some people think it has anti-aging properties. Sometimes we use it in cases of epilepsy because it does help with, it can have some incremental benefit there as well. And krill meal also contains, I didn't put it down here, also contains an antioxidant from algae called astaxanthin. Astaxanthin is what makes salmon red because they eat this red algae. And one reason why salmon has such good antioxidants in it. So these are pretty good. They're quite tasty. The krill meal is kind of like has like a tidal pool flavor to it, and it has nutritional yeast, which is a little bit cheesy, which has B vitamins and trace minerals. Um, and depending on the size of the animal and how much you want to use of it, it's a good quality formula. We tried to make it as inexpensive as we could, but we're using high quality ingredients. So, but I think, and talking about making a bulker size too for people. But I think it's a good general way to go for general health and detoxification. Next slide. And also, we have a discount code, don't we, to offer to people? We didn't.
Yes.
We
Y
sp I spaced out and mentioned it to you, but you have that together.
yes. Yep.
Hey,
It's
for
in the
Haley.
chat.
Haley has it together. But
It's in the chat. It's just Doc Rob Live 8 is the
oh,
code. That'll be for 25% off site wide.
oh, good. Well, that's pretty decent. So that also gives you something you can try out here. Okay, and then we have 2 more formulas, my hepato support, and this is the old-fashioned bottle from the company before they were sold and let me go. And it has silymarin. Alpha lipoic acid is a biphasic antioxidant. It's effective in both in a fatty environment and in a water-soluble environment. B vitamins, which help the liver to detoxify. It has that choline, methionine is another amino acid that helps the liver along, and vitamin B12. And it's very effective. I've used it for years for elevated liver values and whether we know what the problem is or not. And it's done a pretty good job. Depends why the liver values are, elevated, whether how well it's going to work. And then the RX curcumin, which is a form of turmeric that's very, very bioavailable. This stuff is 50 times more absorbable than the culinary herb. So, that means you get a lot of potency for a very small amount. And the curcumin is actually in these little chew tablets that are fairly palatable, but I recommend that people just kind of crush them between 2 spoons and then mix them in with the wet food. And we've found that cats are very accepting of this as well. as far as palatability. Of course, cats are cats and they make their choices. Next. And then Ultra EFA, this is the version of the fish oil that we currently are carrying. It's an RX Vitamins product. I designed it. I put the lecithin in it and tried to make it as potent as we could. So 900 milligrams of EPA plus DHA plus per teaspoon at the 50 mgs per pound per day of EPA plus DHA. I think that comes out to about the half a teaspoon. I had that written down somewhere. About half a teaspoon per 20 pounds of body weight, I think. Well, anyway, it winds up being quite cost effective to get a good level in your animal because it has 900 milligrams in it. Reishi mushroom is very good for the liver, helps to support liver detoxification, also protects the liver from toxins. And then the five defenders contains contains two strong liver support mushrooms for pets who are especially toxic. Contains the reishi and it also contains the turkey tail. So that's pretty good. And then the RX Biotic is a lactobacillus multi-strain probiotic with a pretty high count. It has about 2 billion organisms per little scoop, and it helps to support healthy microbiome and liver function. And something I didn't mention, is that one of the functions of the microbiome is also to detoxify things. And probiotics themselves have been found to create these detoxification enzymes. And so that's another good reason to use probiotics and to try to support a healthy microbiome is it also helps with detoxification. And I believe that's it.
Mhm.
And here's another question. Well, like I said, we're not leaving until we're done. What was that? Um, let's see. You, Can you use both the Daily Dog and the Five Defenders together? And Gail, yeah, the question is yes, you can. And it depends on what you're using them for, because the Daily Dog has the Five Defenders in it, just not as high an amount as you might get from the pet capsules or from the powder, or from the human capsules. But if you want to give the probiotics and the value that we see, the detoxicants in the Daily Dog, but also have a special need to give more. Like, let's say you want to have the antihistaminic effect of the five defenders, for seasonal allergies, you might find that the Daily Dog isn't high enough in those to help, whereas using a more substantial dosage of the five defenders might do the job.